And welcome back. Well, our next guest says this is the perfect time of year to take care of spider veins. You still have plenty of time before it's shorts and swimsuit season, and that's why.
Yeah, and Dr. Deborah Manjoney is with the Wisconsin Vein Center and Medi-Spa, and she's here with 3 ways to make spider veins disappear.
Hi, good morning.
It's nice to have you, which is good news for somebody that they can get rid of them, because I know it's generally a cosmetic problem, but people who have spider veins are very self-conscious of them.
Yes, they are. You know, and 70% of women will have spider veins at some point in their life. And it's all ages. I mean, we see teenagers with spider veins, and then we see, of course, elderly women with spider veins who just may have so many around their ankles or their lower legs that they feel, if I could just get rid of those, I'd feel much more comfortable wearing stockings, wearing a dress, going to church, whatever.
Yeah, because they can cosmetically look very displeasing.
Yes, they can.
So what are spider veins? When we actually talk about what they really are in our body, what are they?
Well, spider veins are very superficial, you know, at the level of the skin, the epidermis and the dermis, very superficial, little tiny 1 millimeter or less veins that frequently look like a spider. It's a complex that looks like either branches of a tree or a bush or a little spider, and they are not veins that are functional in any way. Frequently they are the result of trauma. If you're bruised, if you have an injury, sometimes you just get a response of this, what we call neovascularity, little vessels growing up. Other times in women, frequently, they are a remnant from embryological development, that you may have a little part of a blood vessel that doesn't totally develop properly, and so you've got these little spider arborizations happening at the end of the vessels.
How do you know when you should have them treated? I'm sure a lot of people come to you just because they don't like the appearance of them, so that's a reason to have them treated.
Right. Sometimes when spider veins can actually be a sign that there may be something else going on in your legs is sometimes when they are around the ankle. The inside of the ankle is frequently an area that if you have a lot of spider veins, it indicates that you've got what we call venous hypertension. And that usually is a reflection of increased venous back pressure because the veins are draining your leg. And if there's back pressure, you're going to see some evidence of that frequently at the ankles. And so, for instance, if the great saphenous vein, which is the vein that runs up the inside of your leg and is a superficial vein that frequently becomes non-functional, then you may see spider veins around the ankle. You may also see spider veins behind the knee in other areas that could also indicate that there is a problem with a trunk vein underneath. Especially if people have throbbing, if they've got itching of the skin, if they've got generalized leg discomfort of any kind, aching, then the spider veins may all of it's being seen, but it could indicate there's something more going on.
I think that's great to mention those symptoms, that aching, the itching, you know, things like that people can feel.
Restlessness, cramping in the legs at night. All those things may indicate that there's a vein problem going on that might indicate you should have more diagnostic studies done, like an ultrasound.
Great tips on there. How can we get rid of them? There's 3 specific ways that you want to talk about.
There are actually several ways. Sclerotherapy is what we call the gold standard of treating spider veins. And sclerotherapy is injecting an irritant into the vein to injure the inner wall of that vein so it closes off over time. It's
and
a
here
process.
Some before and after pictures. Okay.
Here before and after pictures. And it is a process. Spider veins may take 2 or 3 treatments, sometimes even more, depending on where they're located, to get rid of them. Whereas treating a varicose vein may only take 1 treatment. So spider veins with injection therapy may frequently take more than 1 treatment, and that's why it's a great time to start now. The other ways we treat spider veins besides the injection treatment is with a superficial laser. So we can use a laser on the surface. It's a 0.5 millimeter or 1 millimeter spot size, and it can really erase the spider veins as we go. Now, what that does is it injures the vein from the outside, and then we will inject into a little vein that we see underneath feeding into that area. So we have what's called a double injury technique, where we're injuring from the outside and the inside, and it tends to speed things up and reduce any of potential side effects you might get from treating spider veins, like a little discoloration of the skin that could be retained.
What about radio frequency and IPL?
Okay, IPL, which is intense pulse light, is multi-spectrum light, and it works great for treating certain types of spider veins. So if spider veins are very faint or they're on the face, they're on certain areas of the legs, very tiny, intense pulse light works great. And we have different filters that we can use to really attack the blood vessels more than the discoloration of the skin, or more than trying to improve the skin tone and texture. It also works very well for vessels. In addition to that, we have a little radio frequency needle that's kind of like an electrolysis device that we can use to actually puncture into the skin right on top of the vein or into the vein, and it will sizzle it and make the little vein go away. all you feel is a little needle poke. You don't feel anything more than that. And all the injection therapies we use are using the very tiniest of needles you can imagine. So it's not really painful. A little bit of discomfort is all that's going on, and it's really
great.
very quick.
And I think it's great because, like you said, some of those spider veins could be a symptom of something more serious to come.
That's exactly
So
right.
Either way, it's good to go and get them checked out. Now is the perfect time because A, it's going to be nice out before we know it. We're going to be wearing our shorts and golfing and playing tennis and all that. But also, you've got this great special for Morning Blend viewers only. All you have to do is mention that you saw Wisconsin Vein and Medi-Spa here on the Morning Blend, and you'll receive $100 off on your first treatment of spider veins. Here's where you can find the Wisconsin Vein Center and Medi-Spa. They're located in Pewaukee on Georgetown Drive. The phone number to call is 262-746-9088 or visit their website at wimedispa.com. Great information.
Thank you, and
Thank
a great
you.
time to start getting beautiful legs for the summer.
Thanks.